take you inside the tent, get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Professor of Orthopedic Surgery, Dr. Nirav Pandya. Hey, Doc, what's going on?
I'm doing good. I almost wanted to call in to get that loony bobblehead yesterday. I'm like, it's Doc P from Oakland.
I did. We did think of you, and we might know a guy, so you can call us off air. But are you ready for rapid fire? I'm going to go through all 213 Giants injuries.
Oh my God!
And you just give us 3 words on each one. Can we do that?
We can do it. Let's do it.
All right. Maybe I'll trim the fat a little bit. Why don't we
No chance you do 3 words on anything, but go ahead.
Well, no, it was him that was going to do the 3 words.
Oh, my bad. I missed the cue.
Thank you for your cool joke, though. No, what about Blake Snell, Doc? What about it? How concerned are we?
Yeah, I'd be relatively concerned. I mean, the fact that he had a repeat injury this close to having this adductor issue, and he's had history of adductor issues in the past as well, too. Definitely very concerning. And the thing you worry about is that with each of these injuries, are you developing scar tissue kind of where that adductor muscle attaches? And is it going to be set up for this to happen again and again and again? So either this means a short rehab stint and you're worried about a big injury risk, or is this going to be a prolonged period of time out where you really need to get that healed? So definitely concerned, particularly for that left side of his leg as well, too, which takes a lot of stress. So I'm going to watch closely, and it sounds like he's on the 15-day IL, but I'm a little bit worried it may be more time.
Nick Ahmed, who's out with the left wrist sprain, had a little bit of a setback in his recovery. How tough is it as a baseball player to fight through a wrist issue?
I think it's pretty difficult. I mean, for 2 reasons, whether it's your catching or your throwing hand, even though for someone who is kind of doing day-to-day stuff, even subtle motions that you need for catching and for throwing, if you have any degree of soreness in that wrist, not only can it cause pain, but it also can throw off the fine little things that may allow you to catch, that allow you to throw properly, kind of mess up your velocity. So I definitely think it's something that can be frustrating. Everyone's like, oh, just a wrist issue, should be back. But a little bit of soreness, a little bit of pain, because those ligaments and tendons are so small, can mean 4 to 5 days every time they get aggravated. So something to be concerned about.
Doc, Thairo Estrada is back in the Giants lineup tonight. Missed 3 days with a wrist issue. What should we be looking for there? What's the concern level?
I think you're really worrying about a re-aggravation. If there's a ball that gets hit really difficult, kind of really hard in that area, or he gets impact. And I think the original injury was he was kind of sliding into a base. So once again, you're looking for those subtle things. Is he as aggressive as going towards balls? Is he willing to slide? How's his grip on the bat? So something to watch closely. And if you see a little statistical downcline for a couple days, that's probably what the reason is. But the fact that he's out there, just like with Ahmad, you don't want to take him out there because he's having soreness. The fact that Estrada's back out there is a positive sign that hopefully there's not too much soreness moving forward.
Michael Conforto returned yesterday. He's expected back in the lineup again today. What should we be looking at as far as his ability to play on the regular, or will he need some days off as he starts to get back in the swing?
I think he had 4 at-bats yesterday, played a lot, so I think that's a relatively positive sign in terms of if there's any residual soreness. But I do think, given his age, that there potentially may be some days off sprinkled in there. So, if he's out of the lineup or something he's pulled a little bit early, I don't think fans should necessarily be concerned. I think it's more about managing a hamstring injury at his age where there's a high risk of recurrence for this in major league players to begin with.
Doc, I want to ask you about Christian McCaffrey, who just got a 2-year extension into, past his 30th birthday. What is your belief in that whole NFL running back 30th birthday thing?
Yeah, I think it's a little bit overrated in terms of age. I think what's more important is the number of touches that an NFL running back has had kind of cumulatively in their career. And, we've seen what happens to a Derrick Henry or the Le'Veon Bells. So I think the bigger issue is not necessarily that he's 30. I think more from a kind of a wear and tear risk, it's the number of touches he's getting. But I think the interesting part where age may play a role is, can he be effective, not necessarily injury risk? Because what makes McCaffrey different than a Derrick Henry, who just kind of like pounds the ball all the time, is his speed and explosiveness. So will his effectiveness potentially be impacted in his 30, 31, 32 because he loses that special skill? Less concerned about the injury risk if they're managing their touches. So kind of a twofold take on it. A lot of touches, he's in his 30s, but also can he be effective even if he doesn't get injured moving into his 30s?
One more for baseball while we have you, because there are so many. Robbie Ray coming back off of the Tommy John, threw an inning yesterday in Arizona. What do you have to look at coming off of a 1-inning stint and a possible timeline for him to be able to stretch out and eventually get back?
Yeah, I think for most, major league pitchers, you're seeing return from Tommy John kind of land 12 to 13 months. I think just like with basketball players, when you think about ramping up, you're really looking at how is that arm feeling with throwing, and is his velocity there, is control there? Because decreases in velocity, decreases in control are kind of early signs that something may be starting to brew in that elbow. And then, just like we're seeing with some of the other Giants pitchers, you're looking for other areas that are popping up. Is your shoulder starting to bother you? Are you starting to get some lower extremity pain? So you're looking to see, is he pitching well? And as you increase that load, is his body able to handle it? And if those two things come together, then you could potentially see him returning. And that 12 to 18-month time frame does stand to kind of happen this season.
Okay. Doc, great stuff. We love having you. Appreciate you doing it. We'll talk to you next week.
It sounds good, guys. Take care. Yep.
All right, there it is. Doc Pandya. The proceeding was sponsored by UCSF Health. All right, before we go back